Okay. Hello, everybody. Thank you so much for joining. I have muted all of us so that we can just go through the slides quite quickly before we open up the brainstorming session. I think that might be the most efficient way. Thank you for the wave. Thank you so much. Okay. All right. So what we're going to go ahead and do is just get started. I just wanted to start us off by talking about what we're going to be doing today. Just as a follow-up, we had a session on Wednesday about understanding domestic violence from the male's perspective. And I believe many of you might have heard from that session that we will be doing a follow-up today so that we can just kind of come up with action points, things that we can do going forward. So let me go ahead. Does anyone have any questions before we begin? Any concerns? Okay, so I'm going to go ahead and share my screen. So I probably will not be able to see the chat well because it takes up the whole screen. So just go ahead and chat and know that as soon as we've gone through these brief slides, then I'll be able to see everything and we can take it from there. Okay. I'll also try and be checking in just to see if there's anything urgent. All right, here we go. Oh, good. I can still see your faces, so it's still going to be allow me to highlight. All right, now I'm going to go into full screen. Perfect. Okay. All right, so we're talking today. We're talking about being a task force, and this is a very loose term. We have not formalized a task force, but that is definitely something that we can talk about if we're thinking that that's a good idea to do. This is just a brainstorming session for us to figure out our way forward. Okay. Just some points to note on this presentation. We're focusing on all types of domestic violence this time. Okay, we're going to use DV interchangeable with gender-based violence and intimate partner violence. We're also going to interchangeably use batterers, perpetrators, and abusers. We're also going to switch between victims and survivors. And this time we're going to talk about Kenya, but also we're going to broaden it out to the world because as you guys know, especially now during the COVID crisis, this domestic violence has become a real issue. So we want to try and generalize it a little bit so that it can be shared widely. Okay. Now, why are we addressing this topic? Domestic violence has really become our new pandemic, hasn't it? Yeah. There's been the spike during this COVID-19 period. DV is one of the leading causes of assault and death, particularly for women and for children. It is a public health crisis, and there are many associated socioeconomic costs that come with it. If we think about healthcare, loss of time at work, divorces and separations, child trauma. If we think about how much resources we have to use to tackle it, the police, the courts, if we think about the societal impact, you know, what does it mean to be a woman in your society? Are you empowered or are you endangered? Yeah. What does it mean as far as religion? Is it okay to be hit in your home? So it's got so many different impacts that we really need to address it. And because it's such a complex discussion, such a complex situation, if we think about the fact that women sometimes don't leave when there's domestic violence, or that men can also be battered, or if we think about child sexual abuse and incest, if we think about trafficking, FGM, You know, all these situations, all these scenarios, these are all DV, but they're unique. It's a very complex problem. Okay. So to attack it, we also have to have a very complex solution. Okay. And we need to work together to make sure that it's a comprehensive solution. Yeah. So let's talk about COVID right now, just because it's what's so present right now, and it's part of why we started this series of trainings. In Kenya alone, just in 1 month, there was a 53% spike in reported cases on the hotline. Okay, 53%. That's quite high. In the US, in 1 week, it went up by 20%. India, 50%. Yeah? Turkey, the physical assaults and homicides have gone up. South Africa, 37%. Okay, and you can see the statistics there. There's also been a rise in the number of calls that are coming into the hotlines across the world. There's been an increase in the number of searches for resources online. Okay, the divorce rate in China went up during the Wuhan crisis. So this is something that has shown itself, and it has come alongside the COVID-19 pandemic. It has almost become like a side effect of it. Okay. And what are the reasons why it has become like this? Why are we saying that COVID-19 is such a significant factor? It's because of all the restrictions that have now come into place while we're trying to keep safe from COVID-19, the quarantines, the curfews, the stay-at-home orders, the travel restrictions mean that now people are spending more time in their houses. And if you are a victim of domestic violence, that means that you are now spending more time with your abuser. And it also means that your abuser now has more time to abuse. Okay? There are other compounding factors. So if he was a level 3 abuser before, now he's upped it to a level 5. Why? Because he's stressed, there's economic hardship. Yeah? There's no one to come and knock on his door and check on him. When he's doing things, what happens in the house happens in the house. There's no one who is noticing her bruises. The child is not going to school, so no one is noticing that the child has not eaten. So all these issues are compounding the domestic violence. We also have first responders who are overwhelmed. Already we were not in a good place when it came to handling domestic violence. We were understaffed. There were not enough resources. The police did not really necessarily have dedicated desks at every station for domestic violence. So you can imagine now it has become worse. Victims are afraid to report, both women and children, because of fears of retaliation. Okay. And then we've gone over the police, but also for healthcare workers. What are they focusing on right now? Isn't it COVID? So even if someone comes in with some bruises and some broken ribs, they will not get the priority that they deserve because COVID is our focus right now. So what is our response as helpers, as healthcare workers, mental health professionals, just people who want to see a better outcome in this time of crisis, but also going forward? What is our solution? We're deciding that we're going to take this opportunity now to revolutionize the domestic violence combat landscape. Okay, we're saying that we're going to tackle this head on now. We're not going to wait for COVID to go. We're going to start looking for ways that we can change how we deal with domestic violence. And that's by building up our existing DV supports and measures, and also coming up with new solutions. Okay. All right. So what is our objective for this presentation? Yes, to brainstorm to talk about it openly and freely here in a safe space, and also to eventually, at the end of the presentation, formulate a checklist of things that need to be taken into consideration, and also formulate a resource library that people can go to and say, let me go get information on that curriculum, or let me go get that training. Let me find out more about why women stay in domestic violence. Okay, so we want to form a resource library that people can tap into and learn more about DV so that we can tackle it. All right, so just a quick reminder for those of us who are not in the last session. These are examples of the domestic violence that we're talking about. This list is not comprehensive. In our resource list at the end of the presentation, there are many additional features that have been added, descriptions of domestic violence, even in a Kenyan context. FGM, child trafficking, incest, all these things are listed there. So please feel free to go ahead and have a look at that list. And so you can customize your interventions to the Kenya model. And if you're international, then to your country or wherever it is that you are participating from. Another quick reminder, domestic violence is about power and control. It's about power and control. That's really the bottom line. There are all these other risk and contributing factors listed here, but to the core of it, it is power and control. And you're free to view that. So what does that mean for us? We need to know that this is something that the abuser can either individually control or with the help and support of others, control. It is a learned behavior. They have found that this behavior works. It works in some way or other. It's rewarding in some way or other. And that's why they continue to do it. Domestic violence, that power and control, I call it the demon of power and control. It only has as much power in a person's life as that batterer allows. Okay? It can be 10%, 40%, 60%, or for a batterer who really has no control over their need to power over their victims, to manipulate and control their victims. It could be something that takes them over and they really just feel helpless. The person feels helpless to that demon of power and control. And I say that just because we have seen cases where it's all that it ever really gets to is a slap and some verbal abuse. But it can also go to the extent of homicide, suicide. So it is a spectrum. And depending on how much this person has control over that need to be in power and control, depending on how much they need that will determine how much help they need, what kind of interventions they need. Okay, so we can talk about that a little bit more. We had last time, we also talked about some of the things that have been found to be effective in combating domestic violence. And you also submitted suggestions, which we will be discussing as we go along. Okay, so they will be added to this list. The final list will have everything that you contributed, plus this, plus any other ideas that we come up with during the session. So just before we start on talking about domestic violence, there are some key words I want us to keep in mind. These are all themes. These are all aspects of domestic violence that come into play. So when we're thinking about brainstorming about domestic violence, let's pull from this list an even longer list and say, yes, let's talk about stigma. Let's talk about parents. Let's talk about the elderly and the disabled. How are they going to be handled in the issues of domestic violence? how are travel restrictions impacting domestic violence, and what can we do about it? So we'll put this slide up just so that it can help guide our discussions. And now we're just about ready to start our discussion. So I am now going to unmute you guys. That's not what I wanted to do, excuse me. Okay. Okay, so what I'm going to do is allow you to go ahead and unmute yourself at your discretion, just so that we have everybody have a chance to speak. Maybe if you raise your hand, I can click on you and I'll call on you, and that will be a cue to unmute and go ahead and speak, just so we can have some kind of order, if you like, that way. Again, I'm going to go ahead and put up this slide. Our first discussion today, or rather our first point of reference, is going to be the victim/survivor. And if we could just kind of talk about issues around the victim during the period that she's going through an assault, during the period that he is going through an assault. What are the things that we can do to assist? Okay, so while you're thinking about that, I can go over some of my notes here. And just give me one moment. Oh, did you guys have any problem with a password request? Anybody? Anyone have a issue with a password request? Okay, let's see here.
No, I didn't.
You did not, yeah? Okay,
yeah.
No password. Okay, any comments, thoughts so far? Anyone would like to just jump in?
Well, I think at first,
Yes.
it will depend on the type of assault that is taking place.
Mm-hmm.
For instance, if it is sexual assault, when someone is going through the assault, the first thing is to go for medical care.
Yes.
So that they follow up on the medical care and reporting it to the police. And in the medical care, they'll also be tested for HIV and sexual transmitted diseases.
Okay.
And pregnancy test if it's a lady. So that there can be some intervention, whether to be given the morning after pill or to take PrEP, which prevents someone from getting HIV.
Okay.
And also they get the counselor is going to take them through their expectation, especially with PrEP, where the drugs effects, what to do after the 30 days are over, because they're supposed to come and do a test, another test, confirm whether they're HIV positive or not. Because yeah, but also within the time limit, because if someone like comes to be tested like a week later, that is too late for any interventions to take place, except for the medical intervention in terms of whether there's bleeding and everything.
Right.
Yeah, but I think also with kids, when they're young and they've been sexually assaulted,
yes,
they really, they know something wrong has happened to them, but they cannot fully understand it. As they continue with life, as they get older,
yes,
that's when they they make sense of what took place.
Mm-hmm.
So the parents are supposed should or ought to be close to them
Mm-hmm.
during that time, so that they can help them with the emotion when they're either emotional or whichever behavior they notice the difference of their behavior, so that
Yes.
intervention can take place.
So there needs to be some.
So I think also
mm-hmm.
talking to because I think the parents usually are very affected.
Yes.
So talking to the parent and their parents who maybe because of the situation they're in,
Yes.
it's what has made the child be in that situation in the first place. So also talking
Yes.
to the parent on how they can intervene in terms of protecting the children, and also some of their behaviors.
Yes.
Like for instance, if
Yes.
a parent has because of maybe their poverty level or because of their mental status,
Yes.
they tend to think there's nothing I can do about this situation. And sometimes you find that members of the same family, like the sister has been abused, like the siblings in that house have been abused.
Yes.
Then it's question on how the parenting style or what the parent is doing in
Yes.
terms of. So I think it's a combination of talking to the child or play therapy to the child so that they can be able to express themselves. At the same time, really having counseling with the mom or the parent,
Yes.
so that they can better help the child even when they're at home.
Okay. All right. Thank you so much for that. You've really outlined a lot of good interventions for children who are experiencing sexual abuse. You've also highlighted those complex issues. Like you mentioned that the child, when the child is going through child sexual abuse in the home, it's also a signal of other types of abuse going on in the home. Like with the mother and the fact that there might be this perpetrator who is targeting the child, but also targeting the parent, and how that can be handled. And then also what healthcare interventions happen when the person is taken to the hospital, if they're able to make it to the hospital in time. What I also would want to understand is the information widespread? What parents can do when a child comes home or when they realize that their child is experiencing domestic violence? Are they able to communicate? Do they know this? Is this information widely spread? I'm guessing that it's probably not so widely spread, but I'm not sure if they're briefed at the hospital when they go. Would you happen to know?
Okay, not okay. So with some, like in communities, we
Yes.
have community workers
Yes.
who are informed about these kinds of things. We
Okay.
also have like different, like vikundi vya mama.
Yes.
So in such vikundis, people go and psychoeducate them on violence.
Okay.
But the intervention, the information needs to be more than how it is today.
Okay.
There's a lot of interventions that need to happen, because you find that most parents, especially if the perpetrator is a relative,
Yes.
quite a number of parents, they try to cover up.
Yes.
But they don't know that in the process, the child is harmed, because the voice of the child is the voice of the child is oppressed in a way.
Yes.
So I think there's a lot of work in terms of information giving to parents.
Yes.
And also in children facilities such as children's home.
Yes.
in other facility places
Yes.
where parents need to be more informed. And I think one of the place where most parents can be informed about child violence can be in the MCH, that is the maternity clinic.
Okay.
Because at one point or another,
yes,
parents are going, like, the mother is going to come for maternal clinic
yes,
before delivery.
yes,
So I think one of the places that someone can spread this information
yes.
is in the maternity clinic.
Okay, that's an excellent idea. So maybe having written materials that maybe a healthcare professional can go over with her, just how they go over the vaccines and things, addressing some of those issues when the mother is going in for maternal care, and then also maybe having resources listed in the hospitals that if they need to talk to a mental health professional or a social worker, they can get more information through that. Another thing that I really like that you mentioned was using the women's groups, the community groups, even the chamas. This is where we congregate. We can always figure out a way to maybe have sessions, like talk sessions, like the one that we're having now, or have material that can be distributed through the chamas. So thank you so much for those contributions. All these will be noted down. Anyone else would like to step in before we move on to the next small segment?
Hi.
Hello, how are you?
Fine, thank you. I just want to thank Edna for the contribution that she has made.
Yes.
I also just want to add a few comments that indeed it's a challenge normally when we are addressing the GBV cases because of what comes with it. We have the stigma that comes with it that sometimes hinders people from reporting.
Yes.
And also the fact that, especially when you look at the economical status of some families,
yes,
if a child is abused within a family setup and the perpetrator could, let me say, could be either the father or whoever,
yes,
and this is the breadwinner in the family.
yes,
at times it's normally challenging for the mother to just come through and pick up this issue and report as it should be, because of the fear of if this person is arrested, what is going to happen to me, and how am I going to survive with these children,
yes,
especially if they're not dependent. And so that sometimes becomes a challenge. And so the key is in terms of how do we empower these women to the point that they're still able to come forth and report, because in most cases you find that even if a child has reported a case of abuse to the mother, there's that aspect of not trusting that information or just dismissing it off at that face value and not really looking into that. So if it happened once, then the next time the child knows that nothing was done when I reported this in the first instance. So should there be repeated abuse, then the child will take that like it's normal, or what's the point of telling somebody about it, because nothing was done about this issue in the first place. And so that is why sometimes these cases are either discovered later, days later, months later, or discovered in school when we start noticing some changes in their behaviors. That is when now we're like, okay, so something has been going on for a while. And even for those who are able to come up and report, they come for services at the health facility, they've gone through the counseling, but then, the decision-making point remains with the mother.
Yes.
I'm reminded of a case where I saw a mother with like a 2-year-old who was going through abuse, came to a facility, we attended to the survivor, connected them with this, cradle or crew, and the case was now being taken up to another level, but she did not cooperate at that point.
Okay.
So our hands are tied.
Yes.
So I also want to say that when dealing with this GBV case, there's a lot of networking that goes on around it, because if you're a healthcare provider, for example, and you receive a survivor who needs shelter. If you don't have shelter, then you have to network with somebody else who normally offers shelter.
Okay.
A safe place, either for the children or for the mother or for whoever. So
Yes.
networking with either those who provide shelter, either with the legal people, networking, because these are stakeholders who are involved in all this process. Everybody needs to play a role in this. So if there's that good networking with these different key stakeholders, then that can also help in managing these cases. And apart from what my other colleague talked of, using either the women group or what to sensitize. Sensitization can also be done using the media, for example, the local radio channels that we have.
Yes.
If maybe just like 5 minutes
Yes.
sensitization to the community of, should you go through this, then they're able to get the toll-free numbers that they can call in case of such a case, then that can also help in bringing out these cases and later on leading to the immediate intervention that is actually required. Yes, I think I'll stop at that for now.
No, thank you so much. That is very helpful. And you're right, there's getting the word out. Actually, there was a study that they did where they found that the radio is very effective in Kenya in getting the word out to the rural areas. We have social media for the urban areas. So having Facebook, Instagram, Twitter, that's another way to spread the word. But yes, sending out those sensitization messages and also figuring out, sometimes decentralizing the solution. Because like you mentioned, Edda, sometimes the women themselves, they're the ones in the house, they know what is practical and what is not practical, and really what they need. Is it economics? Is it housing? Just all those that you've just highlighted, Lynette. It's those are the issues that a mother or a wife, even though she's the victim, knows. So maybe if we put the onus and the power more into the hands of the victim, and we say, what do you need? And then have the women's groups or the little communities that they're in, the surrounding stakeholders, now address them on an individual basis. That might be a good way to go. For example, someone in the Chama says, I know it's a safe place for me to go and talk to the women of my Chama, to let them know I don't have money. Can I be put ahead in the merry-go-round? Can I be put ahead so I can have enough money to be able to live in this situation? And to have a discussion around that. So people finding their own solutions is very important, because unfortunately we're not able to reach into people's homes and find a solution for them in the home. What happens is that the same victim, the same mother, may end up being the biggest barrier. Like you said, she can say, I'm no longer pressing charges, I'm not going any further with this, there's nothing wrong here, there's nothing for us to be doing. And that is because she's feeling the intervention that's coming in is not helpful for her and her family. So that's something for us to think about, how we can offer them the resources, and they select the ones that will be helpful to them. The economic challenges, is it helpful for her to start a small business? Then maybe we fund her small business rather than give her money or tell her to go to a shelter. So just ideas like that. Just a comment through in my notes. It has turned out that
Hey, Gladys?
Yes.
Probably you give me a chance once you're done.
Sure, go ahead.
I'm off the video, so I'm not able to raise my hand.
Okay, no problem. That's fine.
Okay, thank you. How are you?
I'm fine. Thank you for joining me, Austin.
Yeah, thanks. Just a little bit of some contributions. Thanks my colleagues for the wonderful presentations and the contributions.
Yes.
There's something I wanted to add. Just to say that when violence occurs, be it for children or be it for the elderly,
yes,
for the adults, it most of the time it occurs in multiples. you find it could be rape, but there are other things like physical violence coming in. You also find things like cultural, things like economic violence coming in, and all sorts of violence coming in. So as we manage our survivors, we need to really have this in mind so that we give some kind of holistic care and holistic solutions.
Yes.
And secondly, you find that in some occasions we have some of these cases get interfered with at different levels, be it at the legal level, be it at the law and enforcement level. So they get interfered with most of the time. So you find even the adults, they don't want to push on with the cases to be able to get the justice that they require. So at this level, it's important for us to really empower.
Yes.
We need to empower our people. That a person who violates you at one instance, there's a possibility that this thing might reoccur. There's a high possibility it might reoccur at any given level. For children, we have to be very, very sincere with them. That there's no amount of power you can put in it. It becomes a government case. We need to be very clear that when it comes to violence against children, then it becomes now a government case.
Yes.
You can't interfere with it, because they normally say that who is the complainant. But for children, the government becomes the complainant. So that one, we have to be very sincere with them that they cannot interfere with that one.
Yes.
Let's talk about empowerment.
Austin, let me just interrupt. I see that we're at less than 1 minute. If we do disconnect,